Hi, I'm Dr. Martin Rutherford, author of Power Health Back to Basics, clinic director here at Power Health in Reno, Nevada. And today we're going to be talking about sugar. We're going to be talking about blood sugar. And give me a minute or two here, I'll tell you why we're talking about blood sugar. And we're going to be talking about every type of blood sugar, probably except for diabetes type 1, because everybody's pretty familiar with that. And this is a part of a series that we are doing. And this series generated from, I'm also a certified functional medicine practitioner. And I would say I was one of the first group of certified functional medicine practitioners. So I've been doing it for a long time. And I'm seeing the change in functional medicine. And I'm getting a lot of people who come in now who have already been the functional medicine practitioners, except what they're telling me has been done to them. Doesn't sound like what functional medicine practitioners were originally at least taught to do, and I think what are being taught in several of the courses out there. And the other reason we're doing this is because we have, 500 or 600 hours online talking about all of the things that we treat. We have a sort of more or less a chronic condition, chronic pain practice. And so we treat fibromyalgia and peripheral neuropathy and chronic fatigue, vertigo, dizziness, balance, irritable bowel syndrome. But we treat the things, post-concussion syndrome, we treat the things that come and just won't go. And there are certain elements to that. And we have like 500 hours online with addressing each one of those. Polycystic ovarian syndrome and blood sugar and obesity and all that. And that's at powerhealthtalk.com. And in doing that, the thanks that we've got is actually we get a lot of positive feedback, but we get a lot of, well, you're not telling me how to get better. You're telling me what fibromyalgia is, but you're not telling me how to get better. And in the end, I could have 100 fibromyalgia patients in here or 100 migraine patients in here, and they could all be, a little different. So I can't do that. So based on all of that, we came up with the idea this year of maybe just going through a series of what is functional medicine. So this is, this is fifth or sixth in the series. We've already talked about the foundation of functional medicine, what it should be. We've talked about how you do exams and what they mean in functional medicine. We've talked about testing and what that means in functional medicine. We've talked about the initial consultation and how to screen out what I call, I don't call them, my colleagues and mentors called them obstacles to cure. And so I certainly do that because it's important to have people who are able to go through the type of a program that needs to be gone through to get better. And so then we started into the foundational aspects of treatment last week, and we talked a lot about oxygen. And how oxygen is very foundational. So in functional medicine, online, it seems like mostly it's the magic right now. It's to take this pill for that and do your SIBO, take your berberine for your SIBO, take this for your leaky gut, and take this powder and take glutamate, and all that's out there. But people are still getting sick and not getting better. This series is addressing why. So back to the foundation. So foundation of treatment is what we're going through now. And the first foundation of treatment is follow the fuel. The fuel to our body is largely oxygen and sugar. And it seems to be across the board almost universally ignored. When patients come here from other doctors and they're taking all the supplements that I probably would use. I probably wouldn't use as many, but they're using turmeric, and they're using berberine, and they're using adaptocrines, and they're using all this stuff. But they're sitting here and they're still sick because things have been missed, okay? And so we're going through what those things are. And sugar is like among the top physiological abnormalities that are missed. So blood sugar is, and we'll talk just briefly about the ketogenic aspects of fuel, okay, and we'll do it relative to the sugar that we're talking about today. So we're going to talk about sugar, and we're going to talk how it is so important to those of you who have chronic problems. So people come in here, and if they have diabetes, okay, if they have diabetes type 1 or diabetes type 2, they're being attended to. And that's because that's where the mindset is right now. Let's wait until for like the 25 years that it takes to develop a diabetes type 2 or diabetes type 1, and then with the exception of juvenile diabetes. And then let's take care of it then after there's been 25 years of damage done to that person's brain and arteries and heart and all that type of stuff. But that's where we're at because that's the medical model, not anti-medicine. It's just that the medical model is designed for heroic care. It's designed for what it's designed for, emergency care, keeping people alive. And then when things start to not work, then we can give a drug. And of course, if a person has diabetes type 1, they're not making any insulin in their pancreas, they take insulin. Diabetes type 2 is a different animal, and we're going to talk about that in a little bit. But even that, at least you're going to the doctor, and they have a lot of different names for it now, metabolic syndromes, syndrome X, insulin resistance, and we're going to talk about that. But the diabetes type 2 is getting a little bit more attention. They'll basically tell you, exercise. The doctors will usually tell you to change your diet, eat better, exercise, go take a walk 40 minutes 3 times a week, 20 minutes 5 times a week, 30 minutes 4 times a week, whatever doctor you go to. And then maybe if that doesn't work, maybe they give you metformin, of which there are actually better natural alternatives for that. And we'll talk about that in a minute. But that's the blood sugar world right now. But the problem is most of the people who come in here, their problem is low blood sugar, and most of them actually have something called reactive hypoglycemia, which invariably is almost never addressed, and invariably the patient doesn't even know that they have it. So this is those of you out there who want to know, why are the reasons I'm not getting better, taking my supplements and eating better than anybody on planet Earth. This is a big one, all right? This is a big one. So basically, low blood sugar is huge. If you get low blood sugar symptoms are I'm irritable, I get shaky if I don't eat, I get fatigued. No, that would be high blood sugar. I get irritable, I get shaky, I want to kill people when I don't eat. I get nasty. Maybe I get some anxiety. You could have cravings for sugar. A big one is I eat and I feel much better. After I eat, I feel much better. It's not like I'm hungry, I eat, and then I just go on with it. It's like I'm fatigued, I'm getting brain fog, I can't think, I'm in the dumps, and then I eat, and I'm like, I'm fine again. Okay. Those are symptoms of low blood sugar. And there's more. I think I said crave sweets, and if I didn't, then crave sweets is one of them. So that's something that isn't really normally addressed. Here's what blood sugar is supposed to look like. Here's how your blood sugar works. Okay, basically everything that we eat breaks down into sugar. And unfortunately, most of us still in this country run mainly off of carbohydrates. Okay, we have a high carbohydrate diet. For the most part, with the exception of those of you who've been, fine-tuning your diets a little bit more. But basically, it goes like this: you eat something, and if it's protein, it breaks down into amino acids, and that breaks down into sugar. If it's carbohydrates, without getting into the whole Krebs acid cycle and all of the breakdowns. Those break down into sugar, but they break down into glucose, okay? And these things the sugar either goes into your cell, it breaks down and goes into your liver and becomes triglycerides. And so we'll get into that. We'll get into the fatty part of this here in a little bit. But basically, it's going to be stored. It's going to be broken down, or it's going to be mobilized out of the liver where it's stored. That's your sugar, and in the muscles. It's like your muscles store like 400 grams of blood sugar per 100 grams that's stored in your liver. But basically, you eat it, it breaks down to sugar, it gets stored until you need it. Okay. If you eat the sugar, okay, if you eat the food and it breaks down into sugar, then here's how it should go. Here's how the cycle of sugar should go. You eat it, you break down, you're satisfied. Okay? You're hungry. Why do you get hungry? You get hungry because your blood sugar drops, okay, for the record. You get hungry because your blood sugar drops. Then you eat. Then you shouldn't be hungry. Then you should wait and wait and wait. If you're normal, okay, most of the patients who come in here aren't normal. They're sick, okay, and then they wait, and then you get hungry again. You eat, your blood sugar drops. You eat, it comes up. That's the normal flow of blood sugar. But we don't necessarily do that, okay, in this country. We don't necessarily eat the way that we should, and we don't necessarily follow that simple pattern. But what we see is all the things that we just got done talking. We don't see that. We see people who don't eat breakfast because they can't look at it in the morning. We're going to talk about that. We get people who skip meals. We get people who skip breakfast. We get people who are changing their metabolism with new diets to make it happen, to make it work properly. But the circadian rhythm for our main fuel, which is glucose, should be eating about every 2.5 hours. That doesn't mean a full meal. It means I get up, I eat. About 2.5 hours later, maybe I start getting a little hungry. I take just a little snack. I may get hungry at lunch, I eat. Maybe I don't get hungry in the afternoon, but a lot of my patients do because their blood sugar drops. And then you eat, okay? And you just feel fine. You don't get all of these symptoms. The person who gets up first thing in the morning, doesn't want to eat, they have low blood sugar. They have low blood sugar, okay? Low blood sugar is bad. Okay, now the medical model for low blood sugar, the range for glucose, for those of you who are into that end of it, is 65 to 100. Now, I got to tell you, in the functional world, we've tightened those lab ranges up because 65, you're not getting any sugar to your brain. Your brain needs sugar, and we're going to and so 65 is a little low. The functional medicine world has tightened that up to 85 to 99. So as my patients ask me all day, what is my fasting blood sugar supposed to look like? It's supposed to look like 85 to 99, at least in the 80s, with no symptoms. And the symptoms are the ones that I talked about. But here's a typical patient that comes into my office, okay? They can't go to sleep. They wake up, they can't go back to sleep. Well, what's that got to do with sugar? It has a lot to do with sugar. Then they get up in the morning, they don't even want to look food in the face. It's like, no, I can't eat. I can't eat first thing in the morning, anything. So then they start to have a dump later on. They start to get low. They start to get irritable, shaky. They start to get, their temperament starts to get off. And then maybe they eat something that's sugar to bring their sugar up. They think they're diabetic, so they mimic that diabetic who, when their sugar drops, starts eating something that's sweet. And they could eat anything at the time that they're irritable and shaky, and it would bring their sugar up. And so it goes. And so it goes. And maybe they eat at lunch at the right time, or at a consistent time. Maybe they don't. And then they eat the lunch, and then shortly after the lunch, they're either like they're dopey, they can't think, or maybe after lunch they crave more sugar. So these are all signs that your blood sugar is, and there are more signs of low blood sugar than they are of high blood sugar. So here's how blood sugar runs through the night. Okay, you go to sleep. So blood sugar. Let me step back on it. So blood sugar is involved in all of these things. Okay, low blood sugar. If you have low blood sugar, your frontal lobe, which is what gets irritable and shaky, your brain, to work well, needs an absence of inflammation. It needs enough oxygen. It needs enough fatty acids. And it needs pristine, tightly controlled blood sugar. Not too high, not too low. It gets too low, you get irritable, you get shaky, you want to kill people because your frontal lobe is not getting enough blood sugar. You get too high, it's too much blood sugar. That blood sugar starts getting broken down into fats, and this has a lot to do with why the ketogenic diet has come along. And when it does that, that is a very energy draining thing, to break down sugars into fats and store them in your liver. It's energy draining, so after dinner you go. So the brain needs proper blood sugar, not too high, not too low. If you don't have enough blood sugar, you can't make dopamine and serotonin. Today I'm finding that a lot of people know what that is when I talk to them. Those are neurotransmitters. Serotonin is your nice, happy transmitter. Your life is good transmitter. Dopamine is more on like motivation. I want to do things. You know, I want to get up out of bed in the morning. I want to get going. You can't make those. If you have low blood sugar, you can't make. How many of you come in when chronic fatigue, or how many of you come in with fibromyalgia and have these symptoms and think it's something else, or don't realize that the low blood sugar may be the aspect of what your case is, because your doctor told you your blood sugar is good, meaning you're not diabetic. So blood sugars cause that. Low blood sugar is one of the main causes of people not being able to convert their thyroid hormones properly. What that means is your thyroid makes a hormone, and the thyroid hormone that is made is usually inactive. Then that has to be made to become active, and that active hormone is called T3, and that's what gives us our energy. That's what goes to the mitochondria in your cells and gives you energy, okay? And you're fatigued. The low blood sugar in and of itself is going to fatigue you in between meals, but the low blood sugar itself is one of the main issues in not allowing you to make proper thyroid hormone, even though your thyroid tests are normal, and even though you're taking your thyroid, you can't convert it to make it work right if you have low blood sugar. Low blood sugar causes a lot of problems. It is a huge trigger and cause of anxiety and ultimately panic attacks. Maybe not in of itself, but certainly in conjunction with other things. And if you have these other things that are allowing your brain threshold of its ability to react to stimulus, in other words, if your brain is here and you get stressed and you have a reaction, you get a little stressed and you walk on. But if your brain function is here because it's inflamed and there's essential fatty acids that are missing, and you got blood sugar problems, now you have that same reaction, and you got anxiety because all of these things are there. But now maybe the low blood sugar for that hour that you didn't eat and you got irritable shake, it puts you over the edge, and now you got anxiety. And if it's bad enough, you get a panic attack. Low blood sugar is a huge part of chronic problems, and low blood sugar will put a tremendous stress on your adrenals, and it'll put a tremendous stress on cortisol, and cortisol is a hormone that controls your blood sugar. So let's go, and then that will create an inability for your immune system to respond the way it should respond to, say, flus and colds. Maybe you don't need to go get I shouldn't say that. I was gonna say maybe you don't need to go get a flu shot. Maybe you need to get your blood sugar right. So don't take that the way that I think it might have sounded. So anyway, so blood sugar. So let's just go back to blood sugar. Let's go back to the biggest thing I see when people come in here, blood sugar, is insomnia. Blood sugar has a lot to do with insomnia, particularly if you can go to sleep, but you wake up in the middle of the night and you can't go back to sleep. So everybody comes in here. I mean, I'm telling you, if somebody comes in here and they can go to sleep and they wake up and they can go back to sleep, they're either taking drugs for it or there's something very weird about their case, because that's very normal for a patient who has chronic conditions, because the chronic conditions can also screw up your blood sugar and the stress can screw up your sleep. So I'm not used to seeing people who can sleep. Person who goes to sleep and wakes up and can't go back to sleep, 90% of the time it's low blood sugar. Here's how it works. You go to sleep, okay, and you haven't eaten, let's say you ate at 6 o'clock. Say you ate at 6 o'clock, so you've eaten a meal and you've eaten proteins and you've eaten carbohydrates and who knows, maybe you've eaten some junk. And that lasts for maybe 2 or 3, maybe 4 hours. So let's say you go to bed at about 11 o'clock. At 11 o'clock, you go to bed, and after about 2 hours, your blood sugar will start to drop, all right, because you're not eating. You're on a fast all night long. So your brain still needs that blood sugar. Remember we talked about the brain needing proper blood sugar? Your brain still needs that. Your whole body needs it, but you're not really using your muscles at night. But you're using your brain, believe it or not. I know it goes down, but you're dreaming, and your brain just cannot do without blood sugar. So the blood sugar starts to drop, and there's these things called the adrenal glands, which we'll talk about in a future segment. And these adrenal glands, the brain senses that there's low blood sugar, and without getting into the whole pathway, the brain ultimately communicates to the adrenal glands. So we need blood sugar, not the pancreas, not the liver, which many of you may know has a lot to do with that sugar function, but the adrenal glands. And then the adrenal glands put out something called cortisol. Cortisol then moves blood sugar out of the liver where it's being stored. After it's broken down, when you ate it and it couldn't get into the cells, it gets into the liver, it's stored for times like this. So now basically the cortisol moves the blood sugar out of the liver and it moves it into your system, and then the blood sugar goes up and your brain's okay for 2 hours. Okay, and the way it goes is then 2.5 hours later, maybe it's 4 o'clock, you get another squirt of cortisol. Okay, goes up. 2.5 hours later, you get another squirt, goes up. Say it's 6 o'clock now. Now, if you don't get up by 7, now I'm going on a model of you went to bed at 11. So now if you don't go up about 7 o'clock, the cortisol goes up, and it stimulates this thing called the reticular activating system. In other words, it activates your brain to wake up. And you should wake up, and you should be like energetic. Your sugar should be good. You should be hungry because you just haven't eaten since 6 o'clock the last night, right? You should be hungry. You should get up. You should pee, frankly. You should urinate first thing in the morning, and then you should go and eat, and that's how it should be. That would be the normal flow. You would eat because you're hungry because you haven't eaten since 6 o'clock the previous morning, for all those of you who can't look food in the face first thing in the morning, me being one of them, okay? So that's normal. So that's the normal rhythm, but that's not who walks into my office. Normally healthy people don't walk into my office very often. When you have a lot of different problems in your body, when you have inflammation, you have food sensitivities, you have parasites, you have bad bacteria, small intestinal bacteria, all those things, stress, all those things put a strain on your adrenal glands. And so your adrenal glands are the guys, remember, who are supposed to be controlling the sugar. And what happens in those cases is when you go to bed and the sugar drops, maybe you get a cortisol response initially and maybe you don't. So let's say you get one. So let's say you get a cortisol response and it moves the blood sugar out of your liver and into your brain and you're fine. So now it's like 2 o'clock. But the 4 o'clock response, you just can't get that cortisol up because you're sick. And the adrenal glands are being beat up. And the adrenal glands don't have enough strength to produce the amount of cortisol that you need. So what takes over? Adrenaline. Adrenaline now becomes the guy that wakes you up. Okay, for those of you who are not familiar with adrenaline, that's the fight-flight hormone. And so adrenaline takes over, moves blood sugar out of your liver, but it wakes you up, and now you're awake. And you're like, yeah, and your brain's going a million miles an hour, and you're looking at the clock, and you can't go back to sleep, and you're waiting, and of course you fall asleep back right about 15 minutes before you got to get up, and that's a bad thing. And that's another whole story. So that's blood sugar. Okay, low blood sugar is what almost always is involved with a person going to sleep and waking up and can't go back to sleep. Not going to sleep frequently is more poor sleep hygiene or stress. Most of the time stress, poor sleep hygiene. You're watching your videos until 11 o'clock at night. You just watched your favorite basketball team get their butt kicked and you're all stressed out. And you can't go to bed, things of that nature. Okay, so those are the things that will cause you to not go to sleep. But it is low blood sugar that will cause you to wake up and not be able to go back to bed. And that is really the core of insomnia. How many people walk in here with insomnia? Everybody walks in here with insomnia Because they all have low blood sugar. So there's low blood sugar. So I went through all that because that's the foundation for the next things I'm going to walk through. And it's going to make it a lot easier for me to just hit those other things with you. So basically, blood sugar. So there's low blood sugar. The next thing is reactive hypoglycemia. How do you know you have that? Reactive hypoglycemia is me, as my wife and my staff will tell you. If I get really busy and I don't get to do my mid-morning snack because I have reactive hypoglycemia, then I start to get, my head starts to bob. I start getting brain fog. I start getting fatigued. I can't think. I go to lunch. I eat. And by the time I leave wherever it is I'm eating, if it's at home or if it's at a restaurant, I'm fine. Everything comes out. Remember, it shouldn't be like that. Blood sugar and eating should be, I feel good, I get hungry. I eat, I feel good, I wait until the next time I get hungry. It shouldn't be that you get irritable and shaky. It shouldn't be that you fall asleep afterwards. It shouldn't be that you fall asleep beforehand. That's all blood sugar. Okay. Reactive hypoglycemia means that there are things in your system that just aren't working right relative to the liver, pancreas. These are the things that control your blood sugar and adrenals. And what's called the receptor sites on the cells where the sugar has to get in. So there's a lot of herbs and botanicals for that. I take some of those. They work. Sometimes once you get a person through a protocol that gets the inflammation down and gets the infections better and all these things, and adrenals start working better, sometimes a person doesn't need to take supplements. Sometimes they just need to go back to learning how to eat. They'll get up first thing in the morning and they'll be hungry because their blood sugar is correct. So the point is that when these things aren't working, you can eat right and you're sick. When these things aren't working and you're sick, you can eat right. You can eat in the morning, force it down. You can eat a little mid-breakfast meal. You could do lunch, a mid-breakfast, mid-afternoon meal, dinner, maybe some protein before you go to bed to help your blood sugar to not drop so easily. And you can still have all those symptoms. That's called reactive hypoglycemia. And those structures, those organs, those receptor sites, they need to be rehabilitated if they can. If they can be rehabilitated, then it'll work with just the diet. If they can't be rehabilitated, there are a lot of herbs. For those of you who think I'm always holding back on you out there, the one herb that the Indians use is I'll have to think of it now. I forgot of it. It's I'll think of it because this is embarrassing. I just prescribed it yesterday. So okay, I'll tell you what it is when I think of it. So basically that's low blood sugar, and then there's low blood sugar, and that's reactive hypoglycemia. So the next thing is, as you are having these issues, the blood sugar is continually pounding up against your cells. And if you're somebody who eats a lot of, so basically what happens is you eat, the blood sugar comes in, insulin, you've heard of insulin, it comes out of your pancreas, the brain tells your pancreas, put out insulin. Insulin hits your cells. And the insulin is what opens up your cells so that the blood sugar can go into it. And so basically, that's the mechanism of proper blood sugar. But if you eat a lot of carbohydrates, if you eat the standard American diet, if you eat too much, if you eat too much junk, okay, the insulin keeps hitting this cell and it becomes what's called resistant, okay? This becomes resistant to the insulin. Now what happens is the blood sugar sits in your arteries instead of going in here. And for those of you who are going to get into the chemistry, I get that it's more sophisticated than this, but not everybody that's watching this is a biochemist, okay? So basically, it keeps hitting this. This won't open up. It becomes numb. It becomes resistant, okay? It won't respond. And then this sugar has to be broken down, and it's broken down into triglycerides. Sugar's glucose, GLU. Triglycerides are GLY glycerides. GLY, GLU is sugar. So your triglyceride count that is really high on your liver when you get it is not a fat problem. It's a blood sugar problem, and it's the very first sign of that you're going into high blood sugar, that you're going towards diabetes, that you're insulin resistant. Just a little tip for you. So when you look at your blood labs, if those triglycerides are high and you go, wow, they're high, but my cholesterol is good and everything else is good, and you're starting to get symptoms where you eat and you fall asleep afterwards and you can't lose weight, and these are signs of prediabetes, these are signs of insulin resistance, these are signs of higher blood sugar, then you need to start changing now. That is a sign that you're going into insulin resistance. Insulin resistance can take 10 years to show up on your blood panel. So one of the things, several of the symptoms that insulin resistance causes is fatigue after meals. Feels better when you eat. Sometimes, if you have high and low blood sugar symptoms, I get irritable, I get shaky, but I also eat and then I feel bad after meals. You are now in insulin resistance. You are having both of the symptoms. Okay, you're having low blood sugar symptoms, high blood sugar. All of those symptoms are from blood sugar. All of those symptoms are symptoms that our patients suffer from and don't know that it's their blood sugar, because they're coming in with low blood sugar, insulin resistance, and nobody's treating them, because nobody's going to treat them until, at the very least, they can say you're pre-diabetic, and usually not until you're diabetic. What can insulin resistance cause? Insulin resistance is the number one cause of something called small fiber neuropathy, peripheral neuropathy. If you have numbness, tingling, burning, sharp shooting pains in your feet, your legs, your feet, your ankles, maybe all the way up to your knees, they've done a nerve conduction velocity test on you. It doesn't show anything because it mostly doesn't show small fiber neuropathy. And then I had this case in here 2 days ago, and with a lady who was in here 2 days ago, and she has small fiber neuropathy. I said, you probably have insulin resistance or prediabetes. She says, I do. And I said, did anybody connect it to your feet? She said, no, they didn't. So insulin resistance also is the cause of polycystic ovarian syndrome. Polycystic ovarian syndrome, for those of you or women out there who may be having difficulty conceiving or carrying to term, is the number one cause of infertility in this country. It is deemed to be responsible for half of infertility in this country. And when that person goes to the doctor, they are now beginning to understand that that is the case. Not all doctors, but a lot of them. And so what do? They give the person metformin, which is designed to move sugar out of the liver and get the sugar in there. Metformin comes with a lot of side effects. A lot of women can't take it. If they can take it, it comes with a lot of side effects. But I'm making the point that blood sugar, about the only people who are getting really truly evaluated at this point in the blood sugar flow relative to their chronic conditions at this point in time are women trying to get pregnant, and not all of them. Okay, but that prediabetes, again, it has a lot to do with your thyroid not working. It has a lot to do with your brain not working, brain fog, mental fatigue, not making dopamine, not making serotonin. Your intestines, 90% of your intestinal motility is due to serotonin. If you have low blood sugar, reactive hypoglycemia, or insulin resistance, you're not making serotonin. You're looking for the reason you're constipated. Nobody's looking at that. You fix the blood sugar. All this stuff starts getting better. It may get all the way better, or it may get a little bit away, but it is a huge part of that person's chronic clinical picture if they have these things. So insulin resistance is a big deal. It's the reason that you fall asleep afterwards. Insulin resistance then morphs into prediabetes. All right, prediabetes means insulin resistance has finally shown up on your blood test. Okay, now they do the blood test, and they have these little ranges there, and this is prediabetes, and this is diabetes type 2, and this is diabetes type 1. And a lot of doctors still aren't treating even when you get to diabetes type 2. A lot of them are saying, yeah, you're not diabetic yet, so let's just wait and see. Exercise, change your diet. Some doctors will give you metformin, some doctors won't. It just depends on that doctor's sensibilities, maybe how much time they have with you, maybe your insurance. There's just a lot of things that will affect as to whether they're going to treat you or not. So once you start getting into prediabetes, you have a problem. Because prediabetes should not be called prediabetes. It should be called diabetes, because it does all of the things and diabetes does, but it just hasn't raised your blood sugar numbers enough, because there just hasn't been enough damage to those little cells yet to stop enough sugar from not going in. And so they say that we'll wait. What does that do? What does prediabetes does? Everything that diabetes does. It can cause you more than small fiber neuropathy. That can start to morph from small fiber neuropathy into large fiber neuropathy. Large fiber neuropathy is bad. You don't want to have that. Okay, and and this is where, when this sugar, all right, again, it's going to be more sophisticated than what I'm about to tell you, but when this chemically, but when this sugar is not getting in to the cell, okay, it's got to do something. One of the things it does is it breaks down into the triglycerides, what we talked about before, and then eventually it can turn into that fatty liver they've told you had. Okay, at this point, this is usually turning into fatty liver. So those of you who've been told you have fatty liver, there's usually a reason why. Okay, and then it creates all the other things that we talked about relative to serotonin and the dopamine. This is where you start getting the inflammatory responses in the arteries. This is where, so when blood sugar doesn't get into the cells and it hasn't been broken down yet to go into the liver, it starts to become inflammatory. And this is where you start getting inflammation in your arteries, your coronary arteries, your brain. This is the beginning of strokes. This is the beginning of where it is for strokes. So now you're getting into the area of polycystic ovarian syndrome, infertility, strokes, cardiac problems, and peripheral neuropathy. I don't see that many cardiac problems. I do see post-stroke patients. We see a ton of infertility. We see an awful lot of small fiber neuropathy. And most of these people don't really understand. They either don't know that they have prediabetes, or they know that they have it and they don't understand that it's a part of their problem, because they didn't get the diabetes type 2 yet. Not to be one of these like conspiracy theorists or anything like that. This is just the way it is most doctors aren't treating you until you get to diabetes type 2, because now diabetes type 2, they have a definitive diagnosis that has an ICD-9 code that they can bill for, and they have a drug or a set of drugs that they can give to you. And then that set of drugs will be paid for by the insurance company. Now, the next and last area I'm going to go into is the person who comes in here with diabetes type 2, and they're on 3 medications. They're on a metformin, maybe they're on Humalog, maybe they're on maybe they're on a insulin medication, and their blood sugars are were 400 or 500 or 600, and now they're down to 200, and they're happy. Okay. Again, this is a part of chronic pain conditions. Brain needs proper blood sugar, not blood sugar that's 200. Okay. 200, you're still inflaming your arteries. 200, you're still messing up your dopamine. 200, you're still messing up your gut. So, and I didn't get into that part. We'll get into that right now. So basically, what is that? How come that person's blood sugar is up? And the doctors have given them 3 medications, and those medications are not bringing their blood sugar down. Here's why. Okay. There's a number of things that are not being addressed. What are the things that can affect blood sugar? Well, diet, but usually by that time the person's on a diet. Exercise, a lot of them aren't exercising. Some of them can't, because remember, these blood sugars cause a lot of abnormalities in their brain. A lot of these people are starting to get effects in their feet, numbness, tingling, burning. They can't walk as far. It's draining their energy. Well, let's say they're exercising. Let's say they're even eating right. Let's say they've now started eating right, they're exercising, but they're not losing weight. So the reasons for that are some of the other things that we've talked about. The things that can raise your blood sugar. For example, we actually have our patients take their blood sugar 2 hours after every meal until we get a good grip on what's happening in their physiology and until they understand what's going on in their physiology. And here's the things that can raise blood sugar. The person might be we put them on a diet, on a very strict allergy elimination diet. And so the person, it might be eating perfectly normal, yet they see a spike in their blood sugar. What we're going to look for is, well, I ate right, doc, so it couldn't be that. We're going to look to see, was that a food sensitivity? Because when you have a food sensitivity, you eat the food, it creates inflammation. Inflammation causes something called a cortisol response. There's cortisol again, but all you need to know is when blood sugar goes up, cortisol goes up. When blood sugar goes down, cortisol goes down. When cortisol goes up, blood sugar goes up. When cortisol goes down, blood sugar goes down. It's a one-to-one relationship, okay? So, and cortisol is highly inflammatory. So when your blood sugar goes up, you create a lot of inflammation. Okay, when your blood sugar goes, when you have a bacterial infection. Okay, let's talk about, like, you have a bacterial infection in your, I moved on from stress. I moved on from food sensitivities. So let's go back to eating. Okay, let's go back to eating. So basically, I was talking about the diet. I was talking about us keeping our blood sugar under control, and then we eat something good and it goes up. A food sensitivity will cause an inflammatory response. That inflammatory response will cause cortisol to go up. And then cortisol will then raise your blood sugar. So a food sensitivity will raise your blood sugar. You're on 3 medications. You're wondering why your blood sugar is still up. You could have a number of food sensitivities. Most people by now know the number 1 food sensitivity out there that screws them up is gluten, and it is. And then number 2 is milk. After that, it's Katie bar the door. It could be broccoli. It could be anything. We've done this for a long time. It's amazing what people can get food sensitivities through. So if you're watching this, okay, there's a couple of nuggets. You know, you're on medication, it's not working. Maybe eliminate gluten and milk products and casein from your diet for a month and see what happens. See if your blood sugar starts coming down. Another thing that would cause their blood sugar to go up would be, I had already started to move on to that. Another thing would be stress. You're sitting there, you're arguing with somebody, you're upset, you're thinking about your bills, whatever it is. You get stressed. Stress hormone, the main stress hormone that goes up is cortisol. Cortisol raises blood sugar goes up. If you're in a chronic stress cycle, it's hard to get your blood sugar down unless you handle that chronic stress cycle. You might do that by getting rid of the stress. You might do that by meditation, yoga. You might do that by using herbs or botanicals. But that stress is what needs to be. Let's say you have stress and you had food sensitivities. It's going to be hard to get your blood sugar down. Okay. Let's say you have a bad gut. Let's say you get gas, bloating, and you get gas and bloating, maybe diarrhea, every time you eat fruits or vegetables or starches. Okay, that's probably something called small intestinal bacterial overgrowth. There's a bacteria in your intestines that is that bacteria. It's called small intestinal bacterial overgrowth. That's the bacteria in small intestinal overgrowth. And that bacteria, actually, when those bacteria break down, they become toxic to the system. And then they cause the gas and the bloating. But what else they do is they can get through your gut, and most people who have that have a leaky gut. They go into your bloodstream, and they can actually alter the way your insulin works in getting the sugar into your cell. Next thing you know, you have insulin resistance. Or if you have diabetes type 2, this is going to add on to the stress. This is going to add on to the food sensitivities. This is going to add on to all of those things, and you put them all together, and guess what? Your metformin is not going to work. And the next thing you know, they're on Lantus. And the next thing you know, they're on the Humalog. And the next thing you know, you're in here going, I got peripheral neuropathy, and they told me nothing can be cured because I've got 3 blood sugar medications, and they said that there's nothing can be done. We've got it down. It's great. It's not 600. Now it's 200. You're still going to have a heart attack or a stroke. So I'm not sure why everybody's so happy about that. But these are the reasons that your blood sugar is not coming down. Now I could talk about blood sugar for the next 6 hours in case you didn't get that, because each one of these cases could be expanded upon drastically. But the point is this: until you get the whole summation is this: until you get to diabetes type 2, nobody's really taking your blood sugar serious. And when you get to diabetes type 2, and if you're on the diet and you're walking, you're exercising, and you're taking 3 medications, you're pretty much done. There's like nothing else that the medical model will look at. But you need, and there's more, okay? There's more than the bacteria. There's more than just the stress. There's more than just the food sensitivities. There's other things that will cause your blood sugar to not come down. But those are the main ones. Those are the ones that you can really kind of glom onto and maybe look at them in your own world. Now again, this is a part of fuel. Blood sugar is, I could talk about diabetes type 2 for a long time. I'm not going to get into metabolic syndrome and syndrome X because those are just variations of prediabetes and insulin resistance. And so again, it goes low blood sugar, reactive hypoglycemia, insulin resistance, and then prediabetes. All of those are causing you physiological damage. And if you have them, they are playing heavily into your physiology. If I have a patient comes in here, and I have lots that will come in here and go, I'm in Reno, we're right next to California, so we're two hours from Sacramento, and there's this big mountain range in between. And a lot of people, drive over the mountain range to come here, and there's a ton of functional medicine practitioners, alternative practitioners of all different ilk in Sacramento, and they'll come in and I'll look at what they got, and they'll say, I've got fibromyalgia, I got fatigue, I'm chronically fatigued, I have peripheral neuropathy, but I've done all these things, it's not working. The first 2 things I'm going to look at that is usually overlooked is going to be their stress response, and we're going to talk about that separately in a future presentation, and to see if they have low blood sugar. And they'll go, well, no, we're talking. I got chelation, and I had that, and I'm getting the push here, and they're giving me minerals, and they're looking at my heavy metals, and I'm like, you have reactive hypoglycemia. This is why you can't sleep. This is why you can't eat in the morning. This is throwing off your serotonin, your blah, blah, blah. We get them on a diet. I usually go at it first by just I put them on an allergy elimination diet. I then have them eating 6 times a day to try to stabilize the blood sugar. I see if that works. If that doesn't work, usually I start working with the stress response, herbs and botanicals. And by the time we get their blood sugar better, they inevitably feel improved. Is that their whole problem? No. It's part of a number of vicious cycles that create chronic pain. But those are the 2 core areas that usually seem to be missed. And it's always low blood sugar, reactive hypoglycemia the most of the time, prediabetes, and insulin resistance. It's always those because nobody's treating those. So that was the whole purpose of this presentation. It goes back to first foundational thing that should be done in functional medicine is follow the fuel. We talked about, one last thing. Almost forgot. One last thing that will cause your blood sugar to go up. If you were taking your blood sugars all day long and they were normal, but they're high first thing in the morning, check for sleep apnea. Last week we talked about sleep apnea. That's what reminded me of that. Check for sleep apnea. Sleep apnea is going to ruin that whole mechanism that I talked about before, and you're not going to be processing your blood sugar, and your blood sugar is going to be high first thing in the morning, and you're not going to be hungry. Okay, so that's blood sugar. It's kind of the cliff notes of blood sugar, even though it seems like I may have thrown a lot to you. But the whole idea was to give you a broad spectrum idea of one major aspect that is massively overlooked in my observation in the area of chronic conditions. And that goes for all the things. That goes for dizziness, vertigo, balance, migraines. Your brain needs proper blood sugar. I promise you. Stress hormones and blood sugar are involved in every one of those things. Irritable, shaky, anxiety, panic attacks. All of those things, it is involved. If it's there, it's involved, and it's almost always there. So that's blood sugar, or at least that's as much as I think would be prudent to go into in this frame of reference. So now we're into the treatment part of treating chronic pain, and we're into laying down the foundation I go back to the foundational talk, and blood sugar is foundational. Oxygen is foundational. You don't have oxygen getting to your brain, you don't have blood sugar getting everywhere, you don't have oxygen getting everywhere. It's going to be hard for you to get better. Even with your diets, even finding food sensitivities, it's going to be very, very, it's either not going to work or it's going to work for a very short period of time because your mitochondria is not getting enough of the blood sugar, it's not getting enough oxygen to make enough energy for your immune system to respond properly. So foundational. Now, we're going to get into more foundational things next week. We're going to get into some of the foundational supplements that people should be considering. And these are supplements that one of my mentors would say, if you're not taking these, if your sugar's not right, your oxygen's not right, and you don't have enough of these things called fatty acids in you, and if you don't, and if your vitamin D is not right, they would say you have left nature. We're trying to first bring the patient back to a foundational stability that will allow them to get well. And so we're going to start talking about that, or we'll talk about that next week. And at this point, these presentations will probably start to get a little shorter because once you get the foundation under control, you start to see, whoa, that whole group of symptoms got better with the sleep apnea. Oh, that whole group of symptoms got better with the low blood sugar getting better. Oh, whoa, I took enough vitamin D, and we'll talk about that. And oh my God, my heart palpitations went away, and my anxiety got better. So again, this is called, and I didn't do this in the beginning, this is called functional medicine, back to basics, the basics of functional medicine. And frequently, a lot of times you get the basics under control, and the patient's like, you know what, I'm not sure if I need you anymore, doc. So we're going in that direction. So I'll see you next week with some of the foundational basics of the nutritional, supplemental, fatty acid type of things that you need to be able to respond better to other types of therapies that you might be getting exposed to. So until next week, I'll try to remember what it was that I forgot or that I couldn't think of when I was talking about bringing your low blood sugar up, and I'll mention that next week. So that's a hook for you to watch next week. So take care, and I'll see you next week. Thank you for watching.